Hello dear students, welcome to ESchoolOnline. Today I will discuss an essay on coronavirus or COVID-19. So let us start. Introduction. The past 2 decades have seen this world experiencing with alarming regularly outbreaks of viral diseases like severe acute respiratory syndrome, such as bird flu and swine flu. These have caused alarm spread panic not only in population that are directly affected but also in place away from the locations of these outbreaks. Like these viruses, the recent emergency virus which spread rapidly throughout the world and completely changed everybody's lifestyle, the one and only virus that is none other than coronavirus or COVID-19. Coronavirus origin. Coronaviruses are a combination of viruses that cause illness ranging from cold, cough, sneezing to severe diseases such as respiratory tract infection. Coronavirus disease 2019 COVID-19 is a contagious disease caused by severe acute respiratory syndrome coronavirus 2 SARS-CoV-2. The first case was identified in Wuhan, China in December 2019. It has since spread worldwide, leading to an ongoing pandemic. The World Health Organization identified SARS-CoV-2 as a new type of coronavirus. Symptoms and causes. You may have coronavirus if you have these symptoms. First one is fever or chills, cough, shortness of breath or difficulty breathing, tiredness, muscles or body aches, headaches. Loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. Additional symptoms are also possible. Symptoms may appear between 2 and 14 days. After exposure to the virus, children have similar but usually milder symptoms than adults. Older adults who have severe underlying medical conditions like heart or lung disease or diabetes are at higher risk of severe illness from COVID-19. If you have these warning signs, then get immediate medical attention. Warning signals are trouble in breathing, persistent pain or pressure in your chest, new confusion, bluish lips or face. COVID-19 diagnosis. COVID-19 is diagnosed with a laboratory test. Healthcare provider may collect a sample of your saliva or swab from your nose or throat to send for testing. While at home, ideally self-isolate within separate room of your home. If possible, to limit interaction with other family members. If you can't stay 100% isolated in a separate room, stay 6 feet away from others and wear a cloth mask. Wash your hands often. If you have a weakened immune system or have had a severe case of COVID-19, talk with your healthcare provider about your situation. Causes of coronavirus. Coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected or a sick person coughs or sneezes or through droplets of saliva or discharge from the nose. They can spray droplets as far as 6 feet away. If you breathe them in or swallow them, the virus can get into your body. Some people who have the virus don't have symptoms, but they can still spread the virus. You can also get the virus from touching a surface or object the virus is on, then touching your mouth, nose or possibly your eyes. Most viruses can live for several hours on a surface that they land on. A study shows that SARS-CoV-2 can last for several hours on various types of surfaces. Copper 4 hours, cardboard up to 24 hours, plastic or stainless steel 2 to 3 days. That is why it is very important to disinfect surfaces to get rid of the virus. Coronavirus prevention. Wash your hands often with soap and water or clean them with an alcohol-based sanitizer. This kills viruses on your hands. Practice social distancing because Virus can spread up to 6 feet. If you have to go out, stay at least 6 feet away from others. Cover your nose and mouth in public. If you have COVID-19, you can spread it even if you don't feel sick. Wear a cloth face covering to protect others. Don't put a face covering on anyone who is under 2 years old, having trouble breathing, unconscious, or can't remove the mask on their own for other reasons. Don't touch your face. Coronaviruses can live on surfaces you touch for several hours. If they get on your hands and you touch your eyes, nose, or mouth, they can get into your body. Clean and disinfect. You can clean fast with soap and water, but disinfect surfaces you touch often like tables, doorknobs, light switches, toilets, faucets, and sinks. Use some household cleaners that is approved and through to treat a SARS-CoV-2. Wear gloves when you clean and throw them away when you are done. Coronavirus treatment. There is no specific treatment for COVID-19. Who get mild case need care to ease their symptoms like rest, fluids, and fever control. Take over the counter medicine for a sore throat, body aches, and fever, but don't give to children or teenagers. Early in the pandemic, the anti-malarial drugs hydrochloroquine and chloroquine were considered as possible treatments. Conclusion. Scientists and researchers are constantly tracking COVID-19 infections and recoveries. They also have got success for vaccination and the process is continuing. Early estimates predict that the overall COVID-19 recovery rate will be between 97% and 99.75%. By 6 months, its cure percentage will be 0 and the world will be free from coronaviruses. Thank you everybody, and special thanks to the corona warriors for their noble work towards the society. Thank you all.